Hello, I am Dr. Jayanta Datta. I am a consultant physician and intensivist with special interest in diabetes management. I have been practicing in Millennium Clinic as a director since last 20 years. Apart from this, I am a visiting consultant to hospitals around this locality, particularly Charnock Hospital, Uma Medical Related Institute and the Spandan Hospital. Today we are going to talk about various treatment modalities for chronic constipation. In general, constipation in most of the time is readily curable and treatable because most of the causes are related to lifestyle problems. The first thing, one has to go for lifestyle changes, like patient has to be physically active, go for regular exercises, take plenty of fluids in the diet, and also take the diets which are rich in fibers. What are the diets which are rich in fibers? Fruits, vegetables, fortified cereals, products in the diet which are rich in fibers. So constipation patients are advised to take this kind of diet. Second thing about the lifestyle is patient has to go for regular discipline in life and discipline in food intake and toilet habits. One should not delay the urge to evacuate bowel, and in fact every patient should keep an assigned time which for their bowel evacuation in the morning, which should be uninterrupted and undisturbed. So that is the key to regular passage of stool. Even the patients who are in the habit of taking plenty of soda and caffeine and alcohol, all of them causes dehydration. Excessive intake of this kind of foods to avoid dehydration as well as to avoid constipation. A lot of patients, they come to us with abuse of laxatives. In fact, the excessive use of laxatives itself can cause constipation because patient gets used to use of laxatives and bowel also get used to this kind of use of laxatives. So in long term, once you withdraw the laxatives, the patients remain constipated, and without laxatives they cannot pass stool. So one has to go for very judicious use of laxatives for treatment of constipation. Patients should not abuse laxatives, that is very important. Now, what are the laxative options available for the patients? Firstly, patient can go for simple laxatives like colonic stimulants like Dalcolax, which is very commonly used. Second is stool softeners in the form of cremafin, which is very commonly available. Third and most important is the dietary fiber supplement kind of laxatives like isabgol husk, which is very commonly used by the patients, and different kind of fiber laxatives are available in the market. They are also known as osmotic laxatives. What they do, they increase the fiber content of the stool and allowing smooth passage of the stool through the colon and the rectum. Another group of laxatives are available in the market, which is known as osmotic laxatives. What they do, they basically absorb fluid from colon, increase the fluid content of the stool, make it softer and easier to pass through the rectum. And these are also very commonly used laxatives like Dufalac, everybody knows about it, like Peglac kind of liquid laxative. So this can be easily, these are used for the chronic constipation patients. Last but not the least, patient should always remember that they should not use unrestricted laxatives. Whenever they want to go for any laxative treatment for their constipation, they should go for bulk laxatives in the form of isabgol husk and other kind of powder laxatives, which is very commonly available and which are the safest one for the patients. Thank you for watching this video. I hope this video will be of practical use to you and improve your clinical knowledge. If you want to find me, please go to careclues.com and find out.